Hello, I'm Dr. Edward. I'm the host of the Pet Anxiety Summit 2023, and this is your Q&A session where you get to ask me anything you like about anything you need to when it comes to your pets and anxiety, and also when it comes to the presentations that have happened today, which have been all about gut health and how the microbiome and gut affect your pets and all that sort of stuff. So let's see what questions there are. But before we go to questions, I just want to let you know that we have some really awesome sponsors here for the summit. We have let me find it here. There's some free gifts to download from the Well Pet Dispensary that have CBD and a whole lot of other really cool supplements and products that are fantastic for pets, and there's some that are specifically for anxiety. They have a free gift for you to download in your members area if you're participating in the summit, which is a really awesome ebook, The Truth About Anxiety from Well Pet Dispensary. Our other sponsors are polypetproducts.com. And they have awesome probiotics, which is kind of apt, seeing as we're talking about gut health today. And their ebook is to download is Reducing Anxiety, an Objective Guide to a Stress-Free Pet. Then you'll find an ebook from me too in your membership area, which is all about understanding, recognizing, preventing, and treating anxiety holistically in pets. So make sure you drop into your members area in the summit and download those things. But right now, I'm going to be answering all of your questions. So please say hi in the chat. I'd love to hear where you're from, what animals share your life. I'm just got Mitzi here, my little dog, who's trying to get right in the middle of things while I'm talking to you all. Mitzi, give me some space here, little guy. So he's very helpful. So what's our first question? Got a rescue kitten. I don't know how to say your name, Nick. Early trauma, losing all his siblings, separation from mum, and early exposure to herpes and calicivirus, etc. Now he's 2 years old. He has a chronic upper respiratory infection and a big fear of the cat carrier. How can I help him overcome the fear? So the first thing I'd do with a cat like this is I'd bring the cat carrier out, and I'd have it out in the middle of things, in the room, where it just becomes like part of the furniture. Now, time will be part of the desensitization process here. You know, I think one of the things with cat carriers and fear of cat carriers and cats is that that cat carrier only ever comes out when the cat gets put in and gets taken to a place where, you know, less than good things happen, where anxiety provoking and difficult things happen. So the first thing that I would do, Mitzi, give me some space, little guy, is really just have that cat carrier in the home. Maybe start off with it in the corner of the room, leave it in the middle of the room. Eventually you might move it a little bit closer once the cat's like, oh, it's cat carrier, it's just there, it's just a thing. You might move it closer to where the food bowls are, and ideally you'd move it closer and closer to the food bowl until the cat's happily eating the food beside the carrier. What I do then is that I would move the food bowl so it was just inside the cat carrier. And when I did that, I might make sure that the cat had had no food at all for 12 or 24 hours, so the cat was kind of really hungry and motivated. And I just feed them at the edge of, you might have the food bowl just outside the cat carrier to start with and move it just inside. And eventually you'd hopefully be able to move that food bowl to the back of the cat carrier, and the cat would slowly desensitize itself over time to what's going on. So we've got quite a few of you here live. Please say hello and let me know where you're from, what pets you have. Particularly if you've got an anxious pet, we need another question. So please, if you're here live on the call, it's right now is the best time you could possibly have to ask me a question. Now, I've got Mitzi here. In fact, let's introduce you to my lovely animals. Just swap cameras here. We've got Mitzi, who's wanting, come here, Mitzi, come here, buddy. Who's wanting to push right in the middle of things and tell everyone on the call what needs to happen when it comes to anxiety in pets. So here we go. I've got Mitzi. Mitzi's my going to help us with answering the questions. It's going to be we've got 30 of you out there, so there must be some of you that have questions. So please do ask a question right now. Otherwise, I'm going to talk a little bit about Mitzi and how I've helped Mitzi with his anxiety over the years. So Mitzi is a super sensitive, kind of high drive, excitable little guy, and he has in the past been pretty reactive to other dogs. So when we first moved here to Melbourne, he found it really hard because we came from kind of like a large block of acreage into suburbia, and there was all these people and all these noises, and Mitzi was going off his trolley barking at people all over the place all the time. And if we took Mitzi out for a walk and another dog came up to us, probably 8 times out of 10, this little guy would lose his breakfast and go into the red zone, and then I'd have to pick him up. I'd have to be holding him, and he'd be crazy, crazy, crazy. Now, with using a lot of the touch work that I use, essentially, and also working on myself to get my anxiety levels down, because at that time I was in a kind of traumatic, difficult relationship. You know, we can take Mitzi out on walks now, and he's kind of cool. He is able to meet probably 9 out of 10 dogs without any problem. And even the ones that he does have a problem with, it doesn't escalate into real craziness. So you can absolutely rehabilitate reactive dogs. Awesome. Debbie says that she's in Ontario, Canada. She ordered a Thunder shirt for her pug after talking to me last night on the last Q&A for day 1. And we've got a question from Kathy. Now, while I'm answering Kathy's question, I want the rest of you to get your little fingers dancing on the keyboard and ask some more questions. There is no such thing as a silly question. And if you're sitting on anything at all that you think isn't worth asking, they're normally the best questions of all. So from Kathy, I've got Tori is a 10-month-old Schnauzer cross poodle in the west coast of Vancouver Island, Canada. She's hyper-vigilant and also always at the end of the leash. How do we handle calming while out on walks and at the park? Her brain gets hijacked and she's deaf to all attempts at connection and mostly barking. So what's happening is that when you take your dog out on walks and to the park, is that you're getting into that unhealthy orange or red zone. And if you're getting, if she's deaf to all connection, if you get a dog that is not able, that normally responds to your communication and what you ask them to do at home, but then when you get them outside and they stop listening to you, that means that they're in the red zone. It means that they have no ability to actually listen to you and understand, because their arousal levels are too high. So one thing that you can do is start off at home. Make sure that you can do everything you can that reinforces relaxation at home and take away everything that causes arousal at home. So, for instance, a lot of these dogs really love to play with the ball, but playing with the ball is actually not the best thing for them, especially if you do a lot of it, because every time you play with the ball, you're taking them into arousal. You're training them how to be crazy. You're training them to be in this state. And where you want your dog to be is in healthy relaxation, or in that healthy orange zone when they're out and playing, so that they can be aroused to a state where they can play and have fun. But they are not going to go crazy and not be able to listen. Now, so you'd need to think about how to train your dog to relax. And this is the one thing that I probably talk about more than anything else, is how can you train and teach your dogs how to regulate themselves into a really strong state of healthy relaxation. So we've got 42 of you here. Apparently this is not streaming to Facebook like it should. So we're same as yesterday. We're all here on YouTube, and we'll get more and more people come in and join us as we go. Now, we need another question. So who out there's got a question for me? Please ask away. But yeah, the primary thing with these anxious dogs, with these dogs that get out and about and go crazy and their brain turns off and they're barking and they're pulling on the end of the lead, you've got to teach them how to relax. Now then, when you can do that at home, you'll take them out maybe just in your front yard on lead and walk around with them on lead for as long as it takes for them to settle down and be calm. Then you might go outside the front gate. They get excited again. Same thing. You might come back inside the front of your yard and walk around again till they settle down, go outside. Maybe they're a bit calmer. Just go backwards and forwards in front of the gate until you basically bore your dog into getting relaxed. That's another strategy that we can do. But I love working with anxious animals. It's one of my favorite things to do. So we've got a question from Cheryl. And while I'm answering Cheryl's question, we need you people out there to be asking more questions so that I can help you out as we go. Cheryl says, is it possible to use touch therapy once my dog gets into the red zone? Now, the answer to that is both yes and no. Now, if your dog is in such a state that they're a danger to themselves, to other dogs, or to you, the best thing to do with that level of red zone arousal is you've got to remove your dog from the situation that is stimulating them into arousal. You've got to get your dog and get them out of there, right? Now, the other thing that's important, and this is kind of like a higher level strategy, is do everything you can to make sure that your dogs never get into the red zone. Be really sensitive to the kinds of triggers that trigger anxiety and arousal in your dog, and do everything you can to minimize exposure to whatever it is that takes your dog into the red zone and makes them crazy. Now, so what I would do with touch therapy when I'm working with a dog that's got this super high levels of arousal, I'd want to move them away from the stimulus to a point, and you know, if I, for instance, was walking a dog that was reactive and saw another dog coming, I would want to turn, you know, my dog starts lunging and barking, I'd want to remove them, go down the side street, have them not be able to see the situation. Then I would use touch to bring them out of the red zone back into you know, green zone, hopefully. However, you know, I have worked with a few dogs with thunderstorms, in the middle of thunderstorms, that were absolutely well and truly right in that super high red, panting, dribbling, pacing, shaking, absolutely terrified. And you can use touch work in the face of these triggers to help dogs relax. So when I use touch therapy, there's two things that I do. One is that I do a lot of this relaxing touch work at home while the animal is kind of relaxed already, which teaches them how to relax more and more deeply. And then it also is conditioning the dog to relax in response to the kind of touch that I'm using. So then when you get out and about, there's more stimulus coming in, the dog is in higher states of arousal, then they're kind of pre-programmed to relax when you use the touch. So you can absolutely use touch therapy once your dog gets into the red zone, but please try to do everything you can not to let them get in the red zone. What's our next question? From Lillian. I have 3 rescue cats, 2 are fine, but Storm is scared of his own shadow. He runs if there's any noise, especially my door key. I have no idea how to make him better. So rescue cats and rescue dogs are a really different kettle of fish to kind of your typical dog, because they nearly always are poorly socialized. They nearly always haven't been exposed to a whole lot of different things when they're young, when they should be. And nearly all of them have a burden of trauma from the experiences they've gone through. So it's kind of tricky. If you've got a noise-sensitive animal, there's kind of two ways to come at how to help these animals. Number one is do everything you can to minimize the types of noises that cause a problem. So, you might change your key ring to something that doesn't rattle. I mean, I have a key ring that kind of all the keys fit into, and the keys kind of fold out a bit like a pocket knife, so they don't rattle and clang. So that's one kind of direction to come at this with your cat. But the other one would be exploring using pheromones and using flower essences, and maybe using some energy healing interventions or homeopathy to see if you can treat this cat at the root cause of the anxiety and help their whole nervous system so we can use a range of things to move the nervous system into this kind of more healthy relaxation state. We can use holistic treatments and interventions like flower essences and energy healing and homeopathy and acupressure. We can use diet to affect the gut, which then moves the nervous system into a more kind of baseline relaxed state. We can use training and touch to do this. And if we do all these things and none of it works, then we might use pharmaceutical prescription medication to chemically bring the nervous system into a greater state of relaxation. Okay. So Cheryl says, what specific methods did you use on Mitzi to calm him down? So with Mitzi here, he's a bit of a cutie, isn't he? Lovely little fella. Mostly I use touch, relaxing touch, which is one of the things that you're going to learn if you come along and join us in the very awesome 2-day workshop that I'm going to be leading a few weeks after this summit ends. So we've got a Pet Summits anxiety workshop where I'm going to be teaching you how to create and implement a holistic anxiety treatment plan for your pets. Now, that can be to treat existing anxiety. It can also be to help prevent anxiety. So you can have a treatment plan either to treat and heal an existing problem, or you get proactive and you put a treatment plan in place as a preventative measure. And part of what I'll be teaching you during these live online workshops is I'm going to be showing you how to do the relaxing touch with your pets. And I'll be teaching you exactly what kind of touch causes the most powerful relaxation response, and how often to do it, for how long. We're going to practice along together. It's going to be heaps of fun. Okay. We've got a question here. Please talk about Italian Greyhounds, as they are emotionally different to normal dogs. Italian Greyhounds do tend to be a little bit more on the anxious, nervous side than other dogs. That is true. But emotionally, they really are very much the same as other dogs. I think that there is this kind of cute little dog syndrome, if you want to call it that, in that a lot of these dogs that are much smaller breeds tend to get kind of over-soothed and over-mothered and over-loved by their humans because they're so cute and they're so little. And as I talked a little bit about yesterday, if you over-soothe all the time, then your dogs never get a chance to learn how to actually self-regulate themselves into healthy relaxation. They become dependent on the human, and they don't have any capacity for themselves to be able to move themselves into relaxation, especially after they get triggered into arousal or have a fearful thing happen. So Italian Greyhounds, all the same things that I'm talking about with any kind of dog or any kind of cat are going to work quite as well. And I think it's important to talk a little bit about the genetics of temperament here, in that temperament is one of the most heritable traits that there is when it comes to anxiety behavior in animals. So temperament is about 2 or 3 times more heritable or more transmissible from the parents to the offspring than other traits that are determined by genetics. So you do need to be aware that there will be certain lines of dogs or genetics that will have a much more fragile temperament when it comes to anxiety and all that sort of thing. Okay, what's our next question? We've got a few questions racked up, but we need more. So please do make sure you ask me questions. So from Natalia. Hi, my 1-year-old English cocker has separation anxiety. We've been trying to teach him to stay alone, but it's really hard. Do you have any tips? Is it, I don't know what you've written there. I think you're saying, is it okay to let him sleep outside the bedroom or inside the bedroom? Okay, separation anxiety is kind of tricky. Now, the first thing is with separation anxiety is that if you are going to leave your dog alone, have a camera set up that you can monitor on your phone. And if you see that your dog is escalating out of that green zone into orange or red, you should not let your dog be alone in that anxious separation anxiety state, because what will tend to happen is they'll just escalate themselves more and more the longer they're left alone, which reinforces the problem. It's like their whole system is learning that it's more and more fearful and more awful to be left alone. So it's really important not to do that. Again, I'm going to be repeating myself a little bit, because basically what I do with these kinds of animals is I'm going to start off doing a whole lot of touch work. I teach the humans how to use relaxing touch. I'd be getting you to do relaxing touch with your animal 10 or 15 minutes, at least once or twice a day. So that is, a lot of these dogs that have separation anxiety, nearly always with anxiety, there will be what we call comorbidities. There'll be multiple types of anxiety going on at the same time. Maybe there'll be a sound sensitivity. Maybe there'll be reactivity on the leash. Maybe there'll be veterinary anxiety or any other kind of anxiety that you want to talk about. And most dogs that have obvious symptoms of anxiety, their resting state, Mitzi, can you just please stop fidgeting and stay still for me? Their resting state is going to should be over here in healthy relaxation, but most dogs that have ongoing active anxiety systems, their resting state is going to be edging into or quite strongly into this arousal zone. So any long-term level of arousal is unhealthy. And one of the ways that I talk about anxiety is that I really see anxiety as an animal that has lost the ability to regulate themselves from arousal back into healthy relaxation. So that's one thing is, don't leave your dog alone if they freak out. Then you can very slowly and carefully desensitize them to being left alone over time. Now, I've had some dogs just with the touch work and separation anxiety has pretty much gone away. You might need to add in things like CBD and flower essences or essential oils and thunder shirts. Changing the diet can help sometimes. And, in this summit, you're going to hear again and again all these different kinds of holistic complementary interventions and treatments. You need to play around with them, see how your animal responds. And in the workshop that's coming up after this summit that I'll be leading, the 2-day workshop, I go into detail about how to do that and how to understand your individual animal's needs and how to work out to get the right professional team of people on your side. And of course, we teach you how to do the touch work as well. And it is hard. I think it's worth mentioning here that separation anxiety is hard for the humans. Humans can't go and have a social life often. With my old whippet, Pearl, I couldn't leave her alone in the house when we went out, because if anyone came to the door, she would be eating the blinds and stuff. She would go into this high level of arousal, which meant too that, and I haven't had a New Year's party for, 12 years because of my whippet had, that sound thunder sensitivity, and that was also with fireworks. So I'd always have to be with her. So care for yourself through this as well is, I suppose, the other thing that I would say. Cheryl said, my question yesterday was about how my dog paces. I tried petting him like you described and can clearly see how that can work. Thank you. That's awesome. And Cheryl, I encourage you to come along to the workshop too, because you'll learn a whole lot more there. Okay. Debbie says, how can I introduce my pug to the big dog that lives upstairs? I don't want an accidental meeting. Both are friendly. Mine is afraid of big dog but barks at strange dogs, and the big dog loves me. So if you know the people and they're friendly, and then the first thing is to talk to the person who belongs to the big dog and say, hey, I'd love to introduce my dog to your dog so they can be friends, but my dog's a bit scared of big dogs, so can you help me do it in a gentle way to give my dog time to get used to that? Now, if you can, then what I would do is just get the two dogs on lead and in the same space to start with, at a distance, and just sit there and talk to the other human, and maybe the dogs, and tell them how everything's okay and it's all cool and nothing's happening. Isn't this lovely sitting here having a cup of tea, until your dog settles. And once your dog can relax with the other dog at a distance, maybe decrease the distance a little bit. But what I would think would be a really good thing to do as you get the distance closer is have you sitting so you have your pug beside you on one side, then bring the other dog in over on the other side until you can get so you've got your hands on both dogs at the same time. And just sit there and pat them for a while until your dog relaxes, and then you might be able to let the two of them actually say hello to each other. Please be aware that whenever dogs are on lead, they tend to be way more reactive because they don't have the freedom to move where they like. And nearly always, if you have dogs that are, at the end of the lead, lunging and barking another dog, often if you take them both off lead, they're fine. And I remember a really interesting video that I saw once, which was there's this gate. There's two dogs inside the gate and there's three dogs outside the gate, and they're barking and having a fight through the gate. And this was an automatic gate. Suddenly someone pressed the button and the gate opened. And all the dogs kind of looked at each other and turned around and walked away from each other. So it's really interesting, and you need to be aware that if you have dogs on lead, nearly always the reactivity will be worse than if they're off lead. Okay, what's our next question? From Two Trains. I own a 6-year female Yorkshire. Overall, very good demeanour. However, when returning home, she becomes overly excited, excessively jumping on us as we return home. So what I would suggest doing here is, number one, when you are at home, you need to teach your little dog an out, or a down, as in don't jump on me, and an out, no, stay outside of my close personal space. And when you come home, you can then go, whoa, no, out of my space, no jumping. Another way to do that is that you just kind of ignore them. You do the shoulder turns and side on and just keep ignoring them until they stop jumping on you. And then you connect with them, you touch them, you work with them. Because if you come home, your little dog's all excited to see you and they're going up into that high orange or red zone, so that their brain turns off and they're jumping all over you. That's not helpful for them. It's not helpful for you. So you want to be teaching some basic obedience and commands, and then not giving them attention to reinforce that, because if they do jump on you and you touch them, they're getting a reward essentially for doing the behavior that you find undesirable. I think too, it's probably worth talking a little bit here about undesirable behavior. So behavior that's undesirable from your perspective as the human being sometimes is very desirable to the dog. Dogs that like chewing things are going to chew your stuff. And you're not going to love that. But the dog's thinking, this is the best thing ever. I love doing this. So there's kind of a mismatch between what the human perceives as desirable or undesirable things to do and what the dog perceives as desirable or undesirable things to do. So your little dog, loves to jump on you. That's a happy, joyful thing for your little dog to do, but it's not so good for you. And if your dog, when you come home, if you can't say out and the dog listens to it, then that means they're in this hyper-aroused, anxious state. Now, I would be curious with your little dog too, that if there might be some kind of level of separation anxiety. Because if your dog has been in distress when you weren't there, and when you come home, they're already escalated, that can be part of what's driving this over-the-top, overexcited, anxious type behavior. So if your little dog shows any signs of being uncomfortable or unhappy when you're getting ready to go out and leave them alone, that's a sign that there's separation anxiety. And like I said, you really, to get a really good handle on what's going on with your dogs in terms of separation anxiety, you need to have a camera that you can observe when you're out and they're at the home, because sometimes there'll be no destruction or anything like that. What'll happen is that when you get the camera on, you'll see a dog that can't settle, that's pacing, that's moving around, that's obviously unhappy, but you won't see that if you don't get footage. So that's the other thing I'd be curious about with your little Yorkie is, is there an underlying kind of separation anxiety that could be part of this complex thing? It's really important to understand that this whole thing of anxiety in pets is nearly always complex. There's a complex series of events that have caused the anxiety to develop over time. Most animals have a complex set of things that cause anxiety, that trigger the anxiety, fear, arousal response too. So then we've got a question from Mary. We've got one question lined up. How many people have we got here now? Quite a few, I think. Hopefully you've all managed to make your way over from Facebook if you're trying to watch on Facebook and it didn't work. So we've got one question lined up after Mary. Could all of you who have the slightest little question about anything at all to do with anxiety in your pets, particularly if you've got questions about today's presentations, which were all about the gut, the gut-vagal connection, the microbiome, diet, all those sort of things, I would love to answer them. So from Mary, my 3-year-old dog is still afraid of car rides, shakes and heavy breathing. How can I make her calm and enjoy the ride? So your little dog is, finds going in the car fearful. So what would I do with a dog like that if it was mine? I would start probably spending a whole lot of time in the car without going anywhere, using touch, using positive reward. Treats is another thing. The yummy treats is that if you get in the car and you give yummy treats, then your dog starts to build positive associations with being in the car. I would be curious then about, okay, and I'm going to say this again and again, probably in these Q&A sessions, I would be curious about, well, okay, is there anywhere else that this dog shows any of these kinds of signs of being unhappy, of being anxious? And if there is, that you've got a more complex anxiety issue, so you need to be aware of managing it through all the different kinds of stimulus and triggers that come in the environment. And basically, with a dog like this, I would sit down, I would want to find out what's unique about your dog and their anxiety. What's their life story? And then I would want to think about, well, what are all the different kinds of holistic, complementary, alternative interventions that we could try and see how the dog responds? And then I would want to go and, what kind of high-level professionals can we find to get on this dog's team in terms of vets, in terms of trainers, in terms of, holistic practitioners of various kinds. And this, of course, is what I'm going to take you through step by step in the workshop that is going to be coming up a few weeks after the summit finishes. So if you really want to go on a deep dive with me to personally tailor exactly what your dog needs in terms of a holistic anxiety treatment plan, that workshop is going to be a stack of fun. We've got a few more questions. Thank you, everybody. So we've got Luna. I'm from the UK. And after the UK wanting to bad US, we're being spat at and swearing at. She's scared to go out. She's a pocket bully, not an XL that are to be banned. She's afraid. Okay, so if you've got, I'm presuming this is other humans that are being rude to you because of your dog. And, we do know that the pocket bullies do have problems in terms of the shape and suffering and things like that. But it's not cool for other humans to be violent towards you. And it's understandable that your little dog would, be fearful about going out if there's this violent energy and aggressive energy coming in towards you. So, what to do here? Well, the human factor is difficult to deal with. I don't know what to do about that, but the more you can increase your little dog's emotional resilience and the more you can teach them how to relax and the more you can, really work out how to get a holistic anxiety treatment plan in place for your little dog, then the better things are going to be. Now, I don't think you might want to, maybe go to different places where there's not nasty people if you can. Otherwise, you could just put a little jacket saying, "I'm a rescue bully. Be nice to me," on your dog. You could get a little bit kind of lateral, get a nice bright blue or whatever color you like. "I'm a rescue. Be kind to me," on your little dog's jacket, and that might change how people show up for you. Okay, just let me see what's next. So from SB, I have a 5-year-old rescue husky with severe separation anxiety. Has even chewed through the crate when I'm away. He can't be left with toys to keep him busy as he'll eat them when stressed. First thing, don't leave this dog alone. Okay, then the next bit is I can't always avoid leaving him alone and he doesn't settle ever from the minute I leave to the minute I'm back, seen from the video. So I can't build up the time away more slowly. Any tips or things to try to speed the process? Is perfectly calm and non-destructive when I'm home, by the way. That's tricky. The less you can leave your dog alone, the better. If you can find someone who can come in and be in your home when the dog is, when you have to go out, that would be ideal. If you have to go out and you can't do that, then this is the kind of case where I would really, really seriously be considering prescription medication. Giving a really nice dose of something like gabapentin or trazodone plus or minus melatonin, ACP, these other situational anxiolytic, calmative, light sedative medicines. Now, I don't ever do this as a port of first call, but this is a severe problem that you're describing, and the amount of suffering that your dog is going through when left alone and is in that really heightened state of anxiety, it's very uncomfortable for them. So that's why I would be starting to think, okay, what can we do then on the occasions when you must go out and you can't have someone with that dog? We need to think about the dog's quality of life and do something to stop the distress and suffering. Now, that should ideally then be part of a larger picture where you create and implement a holistic anxiety treatment plan where you're working with a trainer on desensitization, you're working with touch to increase regulatory capacity and help them learn how to relax better. You're using all the different kinds of holistic interventions that you can in terms of homeopathy and flower essences and diet and supplements and maybe a fecal transplant and all these other things. So I hope that's helpful. But the first thing is leave that dog alone as little as possible. And if you do have to leave them alone, some kind of chemical calming so that two things don't happen. Number one, your dog isn't suffering extreme distress while they're left alone. Number two, every time they suffer extreme distress when they're left alone, you're building the problem and not healing the problem. Cheryl from Virginia, does therapeutic touch work on other animals such as horses? It absolutely does. I grew up with horses. We done on a ranch, cattle property. We did all our stock work on horseback. Had around about 100 horses bred, trained, competed. And I've just got back in the last few months to getting hands-on and working with horses again. And absolutely, horses respond beautifully to therapeutic touch. I worked with a lovely skewbald fellow a little while ago who had been pushed really hard, a lot of spur and that sort of thing. If you touched his flank, he's just laid his ears back if you touched where the spurs went. And after one session with me, all that behavior was gone. What's our next question? We've already had Luna's one. She's asked it twice. So we've got Cheryl with Parker, who's a 5-year-old adopted tuxedo cat and attacked me when new foster kitty, 8-year alpha female, came in. How to handle getting them to balance with each other. Okay, mixing cats is often a bit like trying to mix oil and water. And if it's not working, and if you're going to be fostering cats, the best way is to have a separate part of the house for each cat. Now, that's kind of like your first step. You can then work with the Fecal pheromones. You can work with flower essences in the water. You can work with energy healing to open up connection between the animals. But you do need to really be aware that you don't force the company of a cat. Now, cats, God bless them, are often really terrible bullies. And they will, if they can bully another cat, they seem to take quite a lot of pleasure in it. So be aware of that and don't allow cats the opportunity to be bullies. If you do have two cats in the same house and they don't get along super well, then you need to have at least 3 litter trays and watering points in places where one cat can't get in the doorway and block the other cat's access to what they need in terms of toilet, water, food. Now, cats will take great delight in doing this, by the way, and trapping another cat in a room by sitting in the doorway and going, right, you gotcha, you can't go anywhere. And they'll stare at them and be mean. So just be aware of that too, yeah? I have an 11-month-old rescue dog that's very anxious when I leave her alone. So we've had a lot of people with separation anxiety today, and I'm not sure if it's in the next day or the day after, but we've got Ness Jones who's doing a really good presentation on separation anxiety. And, I'm going to take a moment here to encourage you to grab your VIP pass, because if you do that, you'll get lifetime access to not only all of the videos from this year's summit, you'll also get lifetime access to all the videos from last year's summit. And Ness Jones also spoke with a bit different angle about the whole separation anxiety thing. So Ness is a real expert in helping with separation anxiety. I've already kind of talked a lot about it. Number one thing is don't leave them alone if they're getting separation anxiety, because it'll just make the problem worse over time. You really need to then work slowly and carefully to desensitize, to build regulatory capacity so that they can be calm and calm themselves. And then, of course, using all the different kinds of holistic, alternative, complementary medicine, supplements, diet changes, and of course, working with your vet, because sometimes anxiety can have medical causes. So there might be pain that a veterinary examination, x-rays and things like that can pick up. There might be physiological reasons where there might be some kind of metabolic issue that's triggering or worsening anxiety, and you need to do blood tests to rule that out too. Which leads us into a really good question from Megan. How do you work with vets who don't believe in giving dogs meds for anxiety when they clearly need it? Well, one thing I'd say is normally it's the other way around. Most vets kind of throw the anxiety medications around like lollies and perhaps overprescribe them, in my opinion. So if you do get a vet who's reluctant to give anxiety medications, number one, be a strong advocate for your pet. Say, look, I'd really like to give this a trial and see what happens. And if the vet continues to refuse, well, you can't make them prescribe it, so you might need to consider seeking out a different veterinarian. But generally, my experience is that vets are more likely to prescribe too many and too often of the behavioural medications than too little. So that's kind of unusual that you have a vet who doesn't believe in giving dogs meds for anxiety. Kate's got a really good question. Are there any risks to using fecal transplant? Dr. Margot Roman, who is like the godmother of this fecal microbiota transplant or fecal transplant when it comes to pets, has given fecal transplants to over 20,000 animals. Now, she's never seen an adverse reaction of any kind of adverse side effect. It's super, super safe, highly effective, really, really good thing, which I learned about through interviewing Dr. Margot this year, and I'm going to be integrating that product into my treating most of the animals that I see, I think, from here on in. It's a really good medicine and very, very, very safe. Okay, from Ellen. I accepted an 80-pound, which for us Australians is about 35, 40 kilo, rescued German Shepherd. He is 2 years old and cat aggressive. Do you believe this aggression could be trained out, or would you recommend medications? Just to continue that text. The Shepherd was severely abused the first year of her life. She only knows the in the crate command. Her foster person had her for a year, but the dog was not around cats. So again, we've got a complex issue here with what I would consider to be multiple issues. You've got a dog that very most likely has had poor, little or no socialization. You have a dog that has a history of trauma, has been abused, which trauma is kind of like embedded anxiety. You know, if you have trauma, the whole body-mind system is pushed into a chronic state of resting anxiety, as well as the emotional discomfort and the possible post-traumatic stress, flashbacks, and all of these things. So any animal that has a history of trauma is going to be far, far more likely to be really, really more anxious, more inclined to be anxious. And there's a much higher incidence of anxiety in animals that have got a traumatic background. So you've got that, and you've got a dog that has got a natural prey drive, a high natural prey drive. And, you know, cat aggressive, is it cat aggressive or is it cat hunting? Because this dog is, you know, dogs are actually hunting predatory beings. So it's not abnormal behavior for a dog to want to hunt and kill things. Could this whole problem be turned around? Well, absolutely it could, but it's probably not going to be a quick fix. And with an animal like this, I would really, really strongly encourage you to come along and do the 2-day workshop that I'm offering as the post-summit workshop, because that's where I'll walk you through exactly how to understand your pet's history, exactly how to work out what kinds of people you need to work with what sort of skills, exactly how to choose which holistic and complementary alternatives to start experimenting with, and how to track and measure all of that as you go along with your dogs. So I've got time for another question or two if anyone wants to ask them, but we'll just go back and give you the opportunity to understand who our amazing sponsors for this summit are. We've got Well Pet Dispensary, which have an amazing range of supplements, including CBD supplements. And CBD is something that I got to tell you, I throw at just about every anxious pet that I see. You will see in your members area for this summit that there is a lovely ebook from Well Pet Dispensary, which is The Truth About Pet Anxiety. Our second sponsor is Polypet, polypetproducts.com. They also have a line of supplements, but one of their supplements, which I'd highly recommend, is a very powerful probiotic supplement. There is also an awesome resource-free ebook from them, which is, let me find it. Can't find it. Reducing Anxiety, an objective guide to a stress-free pet from Polypet. And of course, as the host, I'm giving you a beautiful, very comprehensive ebook, which is all about understanding, recognizing, preventing, and treating your pet's anxiety holistically. We've got another question from Pam. We've got a foster Yorkie, 5 years old, in rescue for 3 years, on Prozac, which is fluoxetine, is the active ingredient in that, does not allow touch, has to have sedated grooms. How can I help her? Come along to the workshop. It's very difficult for me to help you in a very comprehensive way in this format. But again, with these little dogs that don't tolerate touch, one thing that I'll do is I'll put them on lead and I'll start touching them with a wand. Now, it breaks me remember a little white fluffy dog that I went to see when I was living in northern New South Wales here in Australia, probably 7 or 8 years ago. I went to see this little dog. It's on the lead. If I put my hand anywhere near it, there's teeth everywhere and growling. And it's like, this dog is definitely going to bite me if I'm not careful. So I said to the owner, have you got a wooden spoon? They said, yes. I got the wooden spoon and I held the lead so that I was holding the bitey bit where it couldn't reach me. And I started gently touching this dog with a wooden spoon. Now, the dog actually bit the wooden spoon a couple of times. It didn't hurt me a bit. Then the dog got used to me touching with a wooden spoon, gave me a few filthy looks, side eyes, didn't like that much. And eventually, then I could move my hand, always on lead though, and holding the bitey bit away, I could then transfer the touch of the spoon to the touch of my hand, and I could get into working with relaxing touch and body work with that little dog, though I did have to always be careful. Cheryl says, we have a lab cross. She's part Aussie cattle dog. She's fast and high energy. She responds to any sound she hears. She barks and runs around trying to find the sound. So you've got a dog with a sound sensitivity type anxiety. And what I'm talking about, therapeutic touch, the thing is, if you just try one thing, it's unlikely to really be a silver bullet. There's hardly ever a silver bullet when it comes to your anxious pets. And that's why I'm teaching you the workshop in a few weeks' time, because you need to understand how to manage the environment, how to work with behavior modification, which is positive reinforcement training, and I use therapeutic touch for behavior modification. It's very effective. You need to think about medication, which for me includes all the holistic complementary alternatives, things like your pheromones and Thunder's coats. Having trouble remembering what I was talking about. Supplements, diet change, fecal microbiota transplant, diet changes, and then, of course, escalating into pharmaceutical interventions when and how they're needed. But you can absolutely make a difference with these dogs, and it can be work for her. And I would be very surprised if you come and do the workshop that if you don't see, because I'll teach you how to do the relaxing touch as part of that workshop. I would be very surprised if you didn't see good improvements in your dog within, weeks to months of doing and implementing what I'll be showing you. Megan says, most vets in my area don't believe in anxiety. Well, that's kind of weird. And I don't really know how to meet that, because anxiety is a very real thing, and the veterinary industry and the scientific understanding is that anxiety is a very real thing in our pets. So just see if you can find a vet who's on your vibe is the other thing, I think. Caroline says, is a sensitive gut also a connection to separation anxiety? My 1.5-year-old mini poodle suffers from this. He's fed a raw diet and probiotics. So as you will have learned from watching today's presentations with Ruth and Dr. Megan and Dr. Margot, is that the gut can have a profound influence on anxiety in animals. Now, you're already on a good diet and you're already giving probiotics, but it might well be worth experimenting with a fecal microbiota transplant with a dog like this, because Dr. Margot Roman, when I was interviewing her, she told me a number of stories about animals that she was treating for gut issues with the fecal microbiota transplant. And after she treated them for the gut issues, suddenly anxiety was just vanishing. I also have another story of one of the people that I've taught how to do the web bodywork for pets, which is the bodywork modality for pet owners and professionals that I teach all around the world. This dog had an awful traumatic background, had severe gut issues, severe allergies, and incredibly awful anxiety. Also was not happy about being touched in the beginning. It took her a week or two to get the dog to learn to accept touch. And within 6 to 8 weeks, the anxiety was gone. And after about 6 months of regular therapeutic touch with this dog, the allergies and the gut issues, both of which had been unresponsive to veterinary prescription treatments, had completely resolved. So it can work in both directions. If you get the nervous system, move the nervous system into a better place with touch, the gut can improve. If you improve the gut, then the nervous system can improve. And from Cheryl, what do you recommend for a dog that has shown adverse reactions to CBD? Well, number one, don't give them CBD because it doesn't suit them. I would think about PEA, palmitoyl ethanol amide, as an alternative that works through the same kinds of systems in the body. Sometimes too with CBD, you get an adverse reaction because you've just used too high a dose. So another thing might be to start with a really, really low dose and see if your animal tolerates that. You have this bell curve of sensitivity with any kind of medicine, and maybe your dog is just right in that very, very sensitive end, and a really tiny dose will give you the benefits that you're looking for. My cat's ear infections, dental problems, and too long nails can create anxiety. Well, potentially, if they're painful, anything that's painful can exacerbate or create anxiety in your animals. The too long nails thing, well, you can clip them mostly with most cats. So some cats don't let you do anything at all because they're grumpy. Okay, we've come to the end of today's Q&A. So remember, drop into your members area, download your 3 ebooks, because there's so much you're going to be able to learn in there to help your pets. If you haven't grabbed your VIP pass yet, the price will be going up at the end of the summit. So make sure that you grab that too, because it's incredibly good value, and you get a whole lot of other free bonuses and stuff apart from all the video, lifetime access to all the videos. It's a pretty cool package. If you want to come and do the workshop, you can grab your ticket now if you want. It is going to be a lot of fun, and I'm going to empower you to not only understand your pet's unique anxiety, but I'm going to walk you through creating and implementing a holistic pet anxiety treatment plan and I'll be very surprised if you don't get benefits from that in your pets. Just about everybody that I work with within weeks or months is seeing really, really good changes in their pets. So I hope you're looking forward to the next day in this summit. I'll be back tomorrow, same time, same place. Maybe join us on YouTube because Facebook doesn't seem to be wanting to play the game with us at the moment for the live streams. But thank you so much. Have a beautiful summit and give your pets a pat from me.